Okay.
I gotta make sure. No,
All right.
this is very awkward because
I think we're live now. But I'm just gonna, sorry, I had to go. Hi, this is Dr. Tansavatdi. We are talking about eyelid surgery today. Our topic is about the 7 important facts to know about eyelid surgery. Before I begin, I'm just gonna go over all our social media platforms so you guys out there are aware of how to reach us. I would love for you guys to comment if you are on here live or later on when you're listening to this. If you have comments on, what we can address, what you'd like us to answer, please feel free to leave a comment on those videos so we can make them better for those viewers out there. Also, our next week's topic, we're going to be talking about lattice, and we're going to also be talking about non-surgical rhinoplasty. I know that's a big topic that people are interested in, how to do a nose job without surgery, and how do we do a demo next week. So that should be an exciting thing we'll do. And so before we begin talking about eyelid surgery, I'm just going to give you a list of how you can reach us. We're on Periscope at Faces by DRT or at Kristina Tansavatdi, my full name. I know that's a long mouthful. My last name's a little hard to spell, so I've spelled it out here. Also, our website is www.facesbydrt.com, and Instagram is the same thing, Faces by Dr. T. Our Facebook is the same thing as well. And our YouTube channel now, it's Faces by DRT1, and you can also find this if you type up Tansavatdi Cosmetic and Reconstructive Surgery. Tansavatdi is spelled T-A-N-S-A-V-A-T-D-I. Okay, so our Twitter at Faces by DRT, and there's our phone number to reach us directly, okay? So eyelid surgery, I think, I want to talk a little bit about some important facts about eyelid surgery, because a lot of people, this is actually, I would say our first fact about eyelid surgery is that it is the most popular cosmetic surgery that is performed in the United States on the face and neck. And there's a good reason why, because there's minimal downtime with this procedure, great results. You are actually improving the aesthetic appearance of the face with just the eyelid surgery, and it is the first area that we start aging in our face. So the eyes, as you know the quote, and I'm sure a lot of you have heard of the quote, that the eyes are the windows to our soul. And there's a reason why the eye is the central feature on our face, and why eyelid surgery can make such a huge difference on somebody's age appearance. You can make somebody look 5 to 10 years younger just by doing a simple procedure. It's upper eyelid surgery is about 1 hour. You're in and out. It can be done under local anesthetic. And that means, when I say local anesthetic, it can be done with just an injection of some numbing medicine. The surgery can be done in the office, and you can be out of the door same day without any general anesthesia, so you don't have to recover from all of that, those medications. So, second important fact I would say is that the most common thing that people address afterwards is how they feel like their eyes have changed, or that there's some asymmetry. And I want to point out that most of us have asymmetry of the eyelids. So our model here, Anna, I'm just going to point some things out, because if you look at the eyes, the brows are at different heights. Even my brow is at a different height. I'll point that out to you too. And my eyes, when I lift my brows, or the size of my eyes are different shapes. If you take a mirror and you look at, when you normally look in the mirror at yourself, you're so used to and accustomed to looking at yourself that you're not seeing those asymmetries. But as soon as you take the mirror and flip it, so if you take a mirror and another mirror beside it, so you can see the opposite side of yourself, you'll see the differences. That's easy to point out. So Anna, do you notice any differences between your eyes?
Yes, I think my right side's smaller.
Yeah, so your right side seems smaller. Your eyebrow shape is also different. You have a higher peak on the left side, okay? You can notice that. And you're kind of a flatter brow configuration on the right side. So we all have our differences, and that will affect our eyelid shape as well. So the brows are very important to the position of our upper eyelids as well. So that is the next important fact, is that you may go in to see your surgeon, and you're coming and you're thinking, I just want to take care of these sagging upper eyelids. They seem like really crepey here. I look really old from this. I look tired, right? That's a normal response that people come in, they want to look well rested. And so they're actually, the position of the brows will affect the position of the eyelids. And so usually this outside corner of our eyes, as they start, she has such great brow shape. Right now she has fullness on that brow area. But as the brows start to droop, you'll start to see some laxity right here in this hooding in that position. And so just taking care of the upper eyelids with upper eyelid surgery may not address completely the problem. And so if the surgeon tells you that your brows may have to be elevated with a brow lift, don't be surprised to go in that consultation and also be getting a discussion about your brows. So I do want to point that out, that sometimes upper eyelid surgery should be combined with a brow lift at the same time. Not all patients need it, but as we age, that is a typical area where we start to get some of this laxity coming down, and that needs to be addressed. Okay, next most important fact I would say is that the surgery has probably the fastest recovery of any surgery on the face. So, you can be back to work in 1 week. Now that sounds really surprising, but this surgery is literally a quick recovery. People are usually surprised at how easy this surgery is. As I said, it can be done under local anesthetic, so you're not under any general anesthesia. You don't feel groggy after the surgery. The procedure lasts about 1 hour, and then you're done. There's a little bit of bruising and swelling. There's some sutures that we take out at 1 week. But then right after that, you can start applying eyeshadow, eye makeup, mascara, and that usually hides the procedure pretty well. So you can go back to work after 1 week. All right. Another important fact is that there are temporary vision changes after surgery. I think a lot of people get concerned that we're working on the eyes. And so we depend on our eyes for our vision. And a lot of people get concerned that you're going to have permanent changes to your vision. That is very rare, actually. So more commonly than not is there's temporary changes in your vision. So you could have some blurred vision. You could have some tearing. You can have some dry eye problems. Which leads me to the next important fact to know. We all have to get our eyes checked before eyelid surgery. That seems pretty self-explanatory, right? We're operating on the eyes. However, a lot of people are walking around with dry eye symptoms and don't know it. So what I mean by dry eye symptoms, any excessive tearing, dry irritated eyes, if you have allergies, if you wear contacts, you're more likely to have that problem. And then there are some people who just are not producing enough tears, so they have this dry eye issue. So if you have dry eye problems before surgery, it will get worse from the eyelid surgery, especially upper eyelid surgery. When we do upper eyelid surgery, we're taking out skin, so that's an eyelid lift. So that's elevating your eyelids, and you may not be able to close them completely for the first few days after surgery. So that makes you even more prone, if you have dry eye problems already, that you're not able to close your eyes completely, and at night can dry out. So that is very important to get that checked out. And that's a specific test that you need to go get when you go see your eye doctor. It's also called a tear breakup test, or an older test is called the Schirmer's test. But the tear breakup test is probably at this point, the gold standard point I want to make. Are we up at 7? Up to 7? I don't know. I think I lost count. But seventh point out there, the most important fact would be to know when it would be a contraindication to have surgery. So some of the reasons why you might not be a good candidate for upper eyelid surgery or lower eyelid surgery is if you have some underlying eye dysfunction. So some diseases like glaucoma. Glaucoma affects the pressure in the eyes, so it can the pressure can build up after surgery because we're working around the eyes, and so there's some increased pressures, and so it can exacerbate your glaucoma if it's not well controlled. So glaucoma is one thing, and some people don't know that they're prone to glaucoma or that they have maybe an underlying issue that it's starting to, and that's only if you go to see your eye doctor. They'll test the pressures within the globe, within your eyeball, and that will tell you if it's high and whether you're prone to developing glaucoma, and you want to know that before surgery because it can affect your vision from the surgery. It can exacerbate the glaucoma. If you've had previous eyelid surgery, are going to make you prone to having dry eye problems. Also, previous eye surgery. So a particular surgery you want to know about, a lot of people have had LASIK surgery before. If you've had it within the past year, that's one of the sort of contraindications, reasons why we would not do the surgery. We want to wait to give your eyes more chance to recover from that particular surgery. I talked about dry eyes earlier, but then another reason would be if you've got some eye changes from diabetes. So with time, diabetes can affect the nerves, the retina, the back of the eye, and so it's good to know that also before going into surgery. And the last thing is thyroid disease. If you have a history of thyroid disease, you need to bring that up to your physician. And because thyroid disease there's a small population that have hyperthyroid that can affect the shape of their eye and the globe, and that will have an effect on the surgery too. So all these things are important to know going into eyelid surgery. I hope I've kind of covered some of the things. If you do have other questions that I haven't addressed today, please feel free to leave some comments. And again, our topic next week is going to be about Latisse and about non-surgical rhinoplasty. So if you have questions about that or comments, please feel free to leave it on this video. So we'll look at it, we'll take a look, and we'll address those questions at our next video. Same time, same place. It's going to be 11:30 every Tuesday. So next Tuesday, April, the 12th? April 12th at 11:30, and we'll see you here. Last part I want to just add in there, extra, I'm adding an 8th important fact, I would say. If you wear contacts, before surgery, you won't be able to wear contacts after the surgery for about 1 week. So you be prepared to check your eyes and also have glasses for the recovery after surgery. All right, that's it. Thank you very much.
Right.